So coming to the last talk, I'll try to wrap it up in a sort of a faster way. So my part of the talk is merging technology with education and how we can do that. So how we can make our learning so that our practice can be more and more green. So what is e-learning? It's a formalized process. For e-learning, we need a network-enabled transfer of skills and knowledge. But I still feel that it's not a substitute for conventional classroom teaching. There's something fundamentally much more engaging about classroom teaching, especially in smaller groups, that this can't substitute, but it's better. It'll cut down on the environmental carbon footprint, as you saw, compared to, and you can connect with large groups. So, for example, the carbon footprint of this entire meeting must have been huge. And in fact, during COVID times, they actually compared what is the carbon footprint of an online full academic session versus actually in physical, if everybody comes for that meeting, for example, academy and so on. And obviously that the carbon footprint was very high for any physical meeting, obviously. So, so it'll have obviously a lot of technology going into it. The first platform that we at LV Prasad at least we were using and we were familiar with it was from 2017, but it became phenomenally popular during COVID times. And the Echo Clinics is a great e-learning platform. I'll just take you through a short video on the Echo Clinic, which is self-explanatory. There's a video in that. Can you play it, please?
Project ECHO, delivering specialist medical knowledge to regions most in need. It spreads new medical knowledge from specialist hospitals and academic institutions to district hospitals, community health centers, primary health centers, and sub-centers. Rather than medical expertise residing in specialist hospitals or academic institutions, healthcare providers learn from specialists. They learn from each other, and specialists learn from healthcare providers as new best practices emerge. Under the ECHO model, healthcare professionals participate in case-based learning with expert mentors. They acquire new skills that allow them to treat patients that would otherwise need to be referred on. Patients with chronic, complex conditions get high-quality care closer to their home from providers they know and trust. No waiting months to see a specialist. No stressing over getting the right medical aid. No long trips back and forth to hospitals. No spending money on tedious travels. Project ECHO, revolutionizing medical care and education in India. Are you part of the ECHO?
So anyone can utilize this platform if they want to connect with
Project
people of their specialty or with other specialties, and this works very well if you have a lot of comprehensive general physicians and they see complex cases, so they can get on board with specialists from another center, and that's how it works for the patients. What we have been using it as, we have a central hub, and we have been using it pre-COVID also, but it worked very well when COVID came by. And so, for example, we have a Cornea Institute where all our classes at one point were run on the ECHO platform, but now we do it once a week. And this is we have Echo Microbial Clinic or Infectious Keratitis Clinic once a week, where we have various centers collaborating from Delhi, from our other centers across the network. So, and even from our past fellows who are now in Burma and so on. We have on refractive surgery, eco-topography clinic, where we explain some complex subjects like topography, corneal topography, and similarly eco-keratoplasty, as well as resident eco. So these are various platforms that we can run on the echo clinic, echo glaucoma, echo whatever subject that you want. And this is a growing session where the number of sessions have been going up, the diuretics have been going on, and we have the cases can be bilateral. Either we present or specialists who want opinion of people housed elsewhere, they can present the cases. So these are just some snapshots of how well the clinics run. Especially the residence clinic is very popular because in many states the resident education program is still very deficient. So that's why this program is the timing is such that most residents can join this, and at sometimes we even have hundreds of residents joining into this clinics. So the other way in which we can teach without having a conventional classroom is called the flipped classroom technique. Here, course material is sent ahead of time. The presentation that I'm going to, whatever I'm going to speak on, for example, is shared ahead of time. And multiple choice questions are prepared, and those are then answered by the students. And then when it's the actual case, that the timing, the slot for the case, there's a brief presentation by the student, and the MCQs are already evaluated by the course instructor. Let's say if I was taking the course, and then the knowledge gaps that each student could not answer is then taken. So this is a much more powerful way in which they learn and own the subject. So this is, for example, how it is done. Let's say if I'm
flipped classroom teaching. I'm going to take you through one of the assignments that I had was to take a lecture on immune-mediated scleritis for my residents this month. So my homework was first to prepare the presentation, but instead of giving the presentation, so what I do is I prepare it ahead of time. The next thing that I do is to go ahead and share the presentation as well as a lot of course material, which included some book chapters and some online resources as well as review articles on the subject to the residents. So a couple of days after that, what I do is I then just go ahead and prepare a quiz, which is very simple to do on Google Forms. And this quiz would kind of cover the syllabus that I had sent to them earlier and kind of assess or gauge how much they've understood the topic. Also include some clinical photographs from patients, so it makes it more interesting to them. So once the resident answers all the questions in the quiz and submits it, the next thing that I can do is that the entire document would come to me as a report. And in this report, I can see that who are the residents who have scored not as well, and some residents have scored pretty well, and the average would be around about 15 or 16 for this entire group. So when in the 1 hour that I actually spend with the residents during the time that I have to discuss the topic, we can go through all these points and all the problems that they couldn't understand. So this kind of flipped classroom teaching using e-resources, it makes teaching very fruitful and engaging to the students. Flip.
The other e-resources we have, of course, are e-libraries, shadow websites, and of course friends and colleagues. These are many on-site online resources that are there, as well as PubMed and Google Scholar. But of course everybody now is talking about ChatGPT and other AIs. They touted to be the revolution in AI assisted learning, and this is an artificial intelligence chatbot. So it was launched, the latest version, in November 2022, and already it's been taking over. How much can we use it for our medical learning? It's yet to be seen, and there's still a lot of errors that come up, and you can't afford to have errors when you use something for medical learning. So it has to be fine-tuned. It uses both supervised and reinforcement learning techniques on the AI model. So that's all I had to share about e-learning. Thank you.